15,000 Canadians died in 1 year while waiting for free healthcare.
Free health. Yeah, I'm glad you mentioned the free part.
Nearly 15,500 patients in Canada died over the span of 1 year while waiting for surgery or diagnostic scans, according to a new report based on partial government data. The policy brief, titled Died on a Waiting List by the think tank secondstreet.org, says 15,474 patients died waiting for health services in Canada between April 1st, 2023 and March 31st, 2024. The report said only 12 health bodies in 7 provinces provided full or partial data representing 62% of the country's population. The organization estimated the actual number of deaths could be closer to 28,000. Information obtained for the policy brief generally fell into 2 groups: cases where patients may have died waiting for life-saving procedures such as cancer treatment, and cases involved patients dying while waiting for surgery or diagnostic scans that could improve quality of life, such as a hip replacement. Thousands of Canadians across the country find themselves on wait lists, in some cases for several years, with too many tragically dying before ever getting treated or even diagnosed. Harrison Fleming, legislative and policy director at secondstreet.org, said in a January 15th statement, Canadians pay really high taxes, and yet our healthcare system is failing when compared to better performing universal systems in Europe. The 15,474 figure does not include data from Quebec, Alberta, Newfoundland, and Labrador, and most of Manitoba, the organization said. Additionally, Saskatchewan and Nova Scotia only provided data on patients who died while waiting for surgeries, not diagnostic scans. Second Street.org has been tracking this data since 2018, and it has now identified a total of 74,677 cases where someone has died. That's in 6 years, while waiting for healthcare in Canada. It's a small city. The report says that the government healthcare funding is not the issue, citing the provincial government's increased spending on healthcare over the last 30 years, and instead says changes to the system are needed. Total health expenditures represented an estimated 12.4% of Canada's gross domestic product last year, which is a record high outside of the 2020 and 2021 pandemic period. So,
what are the recommendations?
Recommendations. The policy brief makes 5 recommendations to improve healthcare across Canada. The first is to have provincial governments improve their data tracking and disclosure. Another is to reform the way hospitals are funded, changing from block funding or annual checks to cover global budgets to an activity-based funding model where hospitals are paid based on their output in terms of services provided to patients.
What a concept.
Offering more healthcare choices is another recommendation. Patients who can pay for private care should be permitted, the policy brief says, saying this would align with better performing healthcare systems. Allowing patients to pay for treatment at local private clinics could take the pressure off the public system, just as better performing European systems do. Second Street also recommends that governments in Canada expand partnerships with the private sector healthcare providers. Governments in Canada and around the world have found that they can often deliver better care for patients by hiring private clinics to provide treatment to patients in the public system.
Oh, what does that say about Saskatchewan?
Okay, the policy brief notes the positive outcome experienced by the Saskatchewan government hiring private clinics, saying that according to the Fraser Institute think tank, these clinics cost 26% less per procedure. Imagine that. Ontario's auditor noted in 2014 that some services like MRIs, dialysis, and colonoscopies were between 20 and 40% less expensive if delivered in community clinics rather than hospitals. The organization also suggests that government considers offering reimbursement payments for patients in Canada who find out-of-province or out-of-country care. In the European Union, patients have the right to pay for surgeries and diagnostic scans in other EU countries and then be reimbursed by their own government, with the reimbursements covering up to the same amount of the government would have spent to provide the surgery locally. No, not only would this benefit patients who would travel for healthcare, it would also benefit those who remain in Canada. This is due to the fact that patients remaining in Canada for healthcare would move up a spot in the waiting list. Well, yeah, no shit, Sherlock. The fucking fact that you have to explain that shows just how far we've fallen, doesn't it?
Yeah.